with Dr. Catherine Syengo. She, of course, is a Deputy Medical Superintendent at Mathari Mental Hospital, but she's also a consulting psychiatrist at the Nairobi Parenting Clinic. I'll start with this. Is it shocking for you, these kinds of statistics that we're hearing about from NACADA?
No, this is not shocking at all to most of the psychiatrists, because in fact use of drugs in schools and colleges is so rampant such that whenever we get a child or an adolescent whose behavior is disturbed, the first thing we need to do is to do a drug screen. A urine sample, we do a drug screen to make sure that they are not using drugs. And again, through Nairobi Parenting Clinic, we are seeing that children are extremely getting more innovative, and you find that they are now coming up with a shisha pen, where a teacher would be teaching and they are there smoking it, they are putting it in their mouth, and the teacher thinks it's a pen for writing. So it would be very good that for one, we get a lot of education to the children, campaigns against drugs, and also rampant checks and also screens, urine screens.
The focus is a lot on the children, and understandably so, because they're the ones who are using it. But what about the unit that is supposed to educate children about this? And that's not the school, that's the family.
Yes, you're very right, because drug abuse is also in day schools where these children are coming home every day. And it would be very good for every parent to create time for their children. We say that love is actually spelled time, that you cannot say you love your child and you cannot create time for them. When you spend a lot of time with your child, you can actually see these behavior changes. It starts from there. When you see the behavior changes, then you can actually check and be able to confirm some of those drugs. But the confirmatory test is actually to do a urine test in some of those tests, and you can be able to pick it. Of
course, but there are links between behavior and mental health. But explain for us very briefly, what is the link between drug abuse, especially with people who are of school-going age, and mental health?
All drugs are mood altering. They change your mood. It could be changed to be high or to be low. And again, we know that use of even drugs like alcohol or cigarettes, they are the gateway to using other drugs. But we are seeing a lot of cannabis use also, because it's very cheap and available. And you find that people who are using, especially when they are young, when we talk about use of marijuana when the brain is still developing, we are seeing people permanently develop psychosis. And in life, they have to be on medication. So as much as there are people who say cannabis can be used for medicinal use, we know that cannabis is very harmful for children who are under 18, whose brain is still developing. We know that alcohol has many other problems, especially when you're using it for experimental use for young children. Again, we know there is dangers of what we call this binge drinking. When you drink in one sitting, you take more than like 4 beers.
And the World Health Organization came out with a report that Kenya it has a very serious binge drinking problem that might be cascading down towards young people. But I want to go into something that NACADA pointed out as perhaps a new area in terms of drug abuse, and that's prescription drugs. One of the slides is going to be coming up soon. 56.3% reported that prescription drugs were being abused in their schools. Now, prescription drugs, what kind of prescription drugs are we talking about here?
Basically the benzodiazepines, what commonly Valium, they call them Matab. They are very common. It's sad that our chemists, those are drugs which should not be released without a prescription. But it's sad that our chemists would sell anything, anytime. So you find school children can be able to access that. These are the same drugs, the class of benzodiazepines, which are used to spike drugs, or like for travelers when they're used in powder form. So students are accessing them, and they would even spike the drinks, and so that they can use less alcohol to get high. Yes,
but that points also to a problem, and I think you've just touched upon that: the policing of the issue of drugs. In your profession, what are the calls for better policing around access to drugs, prescription drugs, for instance?
Yes, I think most chemists and pharmacists need to stick to what is the right thing, that you should only sell under prescription, and they can actually ascertain which is the correct prescription, and that it's given by a qualified practitioner.
Yeah.
So if we did that, then we would actually, but we also know there are people who abuse drugs, like they would get prescriptions by like Benylin as some codeine, which looks like gives you the effect of heroin. So you find people can buy syrups, they buy from this chemist one, they go to another one, they buy two, like that. But again, a good chemist would be able to tell this is not a good prescription, this is not from a qualified practitioner.
And shouldn't be brought over the counter. Brings us to our next slide. 71% reported that prescription drugs were most readily available over the counter. You've already made this point very clear. Let's move on to one other area that perhaps people don't talk about, which is solutions. We heard Mr. Mutisya talking about using sniffer dogs in school, and that might satisfy a few parents, but isn't that driving the use of drugs further below the surface and perhaps not even addressing the problem at its root?
Yeah, you're right. There are some private schools which go to the extent of using sniffer dogs. But for me, I would say, for one, we need to pass the knowledge, the correct information to the students. Of course, we need to inspect. We use all forms of inspecting. But again, we may need to test, like a urine screen for students we suspect. Because if I know in my school there's a sniffer dog and there's an inspection, then I will not carry those drugs to school. But they're in my body. I'm taking them when I'm at home, or I'm taking them when I'm outside the school.
And that's the problem,
so if I did a urine test, then I would be able to pick it. Like cannabis, you can pick it in the urine even a month later. Yes.
But that's the problem, isn't it? That even if they're not bringing them to school, there still is an environment in which they're able to use it. And who's addressing breaking down that environment? That's what we're trying to find out here.
Yes, we are saying that for every child, the parental role cannot be replaced. Again, for the children in boarding schools, they are being taken care of by the teachers. So the teachers now become like the parents to actually check. But you discover that they're accessing these drugs on their way to school or on weekends. Probably they are breaking out of school or leaving school without permission. So teachers need to check on that for boarding schools. But day school and over the holidays, most children we see, they started using them outside school over the holidays or on weekends. So if a parent is very keen, they can actually be able to pick those behavioral changes, because if you know your child very well, you would be able to tell when they are becoming untidy. If it's cigarettes, you can smell it. If it's alcohol, you can smell. If it's cannabis, you definitely see a behavior change, and you can be able to tell.
All right. Finally, as we wind up, isn't this time, though, to also have a more nuanced discussion around which drugs are more abusive than others? Other countries, for instance, the Netherlands, categorizes marijuana as a soft drug and even sells it over the counter. Are these the kinds of discussions that we should have in order to nuance and distinguish which drugs would be more harmful on society as we wind up?
For me, I wouldn't say that we would even go to the extent of legalizing marijuana, because you can see, like the prescription drugs, they are not supposed to be sold without a prescription, but young children are still accessing it. Alcohol, for example, should not be sold to school children, but there are many of them who access it. So for me, I think the more we legalize more drugs, the more we create more problems, because our chemists and pharmacists don't stick to the ethics of, not all of them, some do, but not all of them would stick. So we would want the regulatory bodies to also be very active in monitoring that. But again, I would say cannabis for a developing mind below 18 years, below 21 years. For the vulnerable children, they can actually predispose them to psychosis. For those who are vulnerable, there's no test we can do to tell this child is vulnerable and this one is not.
All right.
So that way, then it would be better to make sure that if you're under 18, then you're not using those drugs. Even alcohol should not be used by children and adolescents.
All right, Dr. Catherine Syengo, Deputy Medical Superintendent at Mathari, thank you very much for joining us to talk about a very, very shocking and disturbing subject, I'm sure, for most parents.